Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. The health department is governed by the Larimer County Board of Health. Today, we're joined by the health department's Executive Director, Tom Gonzales, here to help us understand how the Board of Health functions and interacts with the health department. We'll also be talking to Dr. Birnbaum, who recently completed his term as a member of the Board of Health and joins us to share a bit about that experience. Tom and Dr. Birnbaum, thank you both so much for joining us.
Thank you for having us.
Yeah, it's great.
Tom, to start, can you explain what the Board of Health is and its relation to the health department?
Yeah, the Board of Health in Larimer County is our governance and policy board. And ultimately, I, as the director, report directly to the Board of Health. And the Board of Health is a 5-member Board of Health.
And how does the Board of Health and then the health department fit into the larger governance structure of the county?
What I like to look at is high policy. That's the Board of Health. So the strategic plan, the approval of our mission, those kind of things, that's ultimately approved by the Board of Health. The operations, the day-to-day, how we carry out our services, that's through the public health director and the team, the staff.
How are these members elected or appointed?
Yeah, good question. I'm going to back up a little bit because in Colorado, there's actually 2 sets of boards of health based on population of the jurisdiction. Counties or communities under 100,000, the boards of county commissioners serves of the Board of Health. So we're over 100,000, so we do have a separate Board of Health that's appointed by the Board of County Commissioners. They're 5-year terms. We'd like to see no more than 2 terms, so 10 years total. And that's what Dr. Birnbaum served, was 10 years on the Board of Health, so he's seen quite a bit.
I can even vote now.
Are there criteria for board membership or for, to kind of throw your hat into the ring there?
There's some guidance from the Colorado Department of Public Health and Environment for boards of health. They always recommend to have a medical physician connected to the community. So that's been an important piece that Bernie's had. They recommend having maybe somebody with a nursing background, a business background, or environmental health, maybe somebody that's got more policy, public health policy or initiatives. But there's some recommendations trying to get a diverse group of 5 on your board. And there are some boards of health that are even bigger.
How often does the Board of Health meet?
We meet once a month, every third Thursday from 6 to 8 p.m.
And are those meetings open to the public?
They are. We post the agenda at least 24 hours in advance so folks can see the agenda, and then they're open to in-person as well as the meetings available on Zoom.
Is there a way that Larimer County residents can submit public comment or come attend a Board of Health meeting?
Absolutely. In fact, the board enjoys that. There's a way you can get on a list Monday before the meeting. We've got it available on our website at larimer.org/health, or you can just show up at the meeting. But there is a public comment. It's usually right after approval of the agenda. We allow up to 2 to 3 minutes for community member to voice a concern or a question to the Board of Health.
That's really great. Dr. Birnbaum, you recently completed your second 5-year term as a member of the Board of Health, and we wanted to hear what your experience was like. But to start, can you give us a little bit of background on what your professional life has been like?
Yeah, sure. I'm a family physician. So my main job is I see patients and teach medical learners, both medical students and residents. I ended up out west. I grew up on the East Coast. I'm from Chapel Hill, North Carolina. I was looking for Chapel Hill, North Carolina, which is how I ended up in Fort Collins, Colorado. They're actually incredibly similar towns. I've always been committed to working with an underserved population. And so that was important. And one of the things I found in my role as a personal physician was that I was missing the influence in public health. And so I was really interested in serving organizations or working with organizations that were interested in the health of communities rather than the health of individuals. So before being on the Board of Health, I was elected to the Health District Board for 8 years. And that was 2 4-year terms from 2008 to 2016. And I loved that. I felt like that was a little mini public health fellowship or degree or something along those lines. The idea of going to a graduate degree seemed like that much. So that's how I ended up there. And then after being on the board of the Health District, which is a governmental special district, I wanted to serve for a larger organization or for a group that was countywide, and thankfully was able to be appointed to the Board of Health.
Was there any one particular facet of the underserved communities that you saw that you really wanted to try and make an impact on?
I mean, the one that's coming to mind right now is the unhoused community. I think those communities have a tremendous impact on our communities. This is a very expensive place to live.
Oh, yeah.
Frankly, everywhere in the United States right now is expensive to live in. And the challenges that that community faces are really unfair. And I think that there's things that we could do as a society. So that was one area. Another one that I've been really interested in is food security. And a third would be substance use disorders. I do a lot of work with addiction and with treating folks with a history of substance use disorders. And I think one of the things that unifies those things is that a lot of people that use services like food pantries or the food bank, like substance use treatment, like homeless shelters, often feel judged by those around them. And they have both social and medical factors that make their lives more difficult. And if we can treat people like humans, then we can help them with their problems, at least it's a start to have a conversation as opposed to othering people.
So, I mean, it sounds like you do have this call to public service, especially for underserved communities. I am curious, what was the process like of actually getting on the board here at Larimer County?
I knew Dr. LaBailey, who was the director at that time, and she encouraged me to apply when there was an open board position. They had a previous physician on the board from Estes Park, who, when he was term limited, they wanted to find another medical provider to be on that board. And so I applied at the time, interviewed with Steve Johnson and Dr. LaBailey, and they didn't think I was crazy, which is good.
So what was that interview process like?
It was questions about what do I see as the major issues involved in county health, right? So, the big things when I look at county health, we live in a very blessed community. You really do. Like the rates of chronic disease and obesity are less than the general population. The rates of smoking are less than the population. The rates of alcoholism are higher. I talked about mental health issues. At the time when I started on the board, the rate of adolescent suicidality in the county was higher than just about anywhere else other than Native American reservations. And I thought that that was worth talking about and highlighting. The community's done tremendous work around that in that time. So those were things that I talked about, I think, in that interview.
Once you joined the Board of Health, was there anything that surprised you about how it functions or the work that they do?
I'll say yes. I mean, I think, when you join a board, you think that you have lots of influence or maybe power. But I think what you have is a little bit of influence. And I think in reality, a governance board's job is to make sure that the fiduciary responsibilities of the department are done. And in some sense, that's a little boring. It's not always that exciting. It's making sure that there's good septic regulations. It's making sure that the budget is being adhered to carefully. It's making sure that the director is working well with their staff. It's making sure that those things are happening. I think really it's listening to the staff, listening to the director, guiding me based on the needs of the community, and then making sure that we're doing our things financially responsibly.
Tom, I guess I kind of wanted to offer the same question to you. I know you have a very long history of public health experience, but having stepped into the director role in the middle of the time that Bernie was on the Board of Health, was there just anything that surprised you about that relationship?
Bernie was one of the members of the board that hired me. So that bittersweet having a board member that was part of that process and then seeing them graduate from the process per se. Quickly, we went right into COVID and just understanding what the public health director's mandates and obligations are, as well as how does that work with the Board of Health. That was something that Bernie was the president for much of COVID. Him and I working together hand in hand, working with the attorney and trying to do the best for this community, which I think the community did a fantastic job. But that was a surprise. It's hard to get a board of 5 together, post it 24 hours and have a meeting. We did that during COVID. We had numerous special meetings where we would email and say, we need to have a meeting within a day or two because we got to talk about some things. So that right there, that process of being a public health director in a pandemic, I learned a lot.
Speaking of COVID, Bernie, your time on the Board of Health covered a lot of pretty significant public health events and challenges. What events or decisions have stuck with you or impacted you the most?
I think that a lot of the decisions around COVID, which, by the way, frankly, were not necessarily even our decisions to make. They were made at the state or the federal level. Yeah. I think those decisions and supporting those decisions were really momentous. I think the way that we approached, at least the way that I approached the question, was how do we protect the community? Public health often or sometimes conflicts with individual rights. We have to wear seatbelts in cars, right? We have to have regulations in our homes about fireproofing, right? We pay taxes to fund firefighters in our community. Public health is another example of that, where during COVID, we needed to wear masks. We needed to do social distancing. And the work that we did and the decisions that we made around that, I firmly believe saved many, many lives. I was a doctor working in the intensive care unit during COVID. I watched many people die. It would have been a lot worse. And the decisions that were made around that time or re-emphasized in our community that were not emphasized in some other communities in Colorado made a difference in the way that we experienced the pandemic. And it didn't mean that those things didn't suck for people. They were onerous for their individual liberties. But my belief as a public health practitioner and as a public health physician is that there are times that the health of the many is more important than the difficulty put on the one. And I think that that's a key principle. And that was hard. We had people come to meetings and call us names. And I think we were following what we believed was the best science at the time.
I'm curious if your time with the Board of Health has changed how you see public health just in your day-to-day life at all.
That's an interesting question. Remember I had 8 years in public health before coming here. I think what it made me understand was that when a governmental organization takes an action, that there will be people on any side of the political spectrum that will have a problem with that action. And that because we are a tax-funded organization, we really have to listen to everybody. And that's hard. The other comment that I would make is that the history of American individualism argues that individual or liberty or autonomy comes first. And fundamentally, that's problematic in emergency situations. And how do we balance that and communicate around that becomes very, very important. So part of my understanding of public health is not just let's look at epidemiologic data to make the community healthy. How do we communicate about the policy decisions that infringe on autonomy? And I think we didn't do that so good. And when I say we, I mean the national.
Yeah.
I don't think I have any particular criticism of this department's communication. I have lots of feelings about statewide communication and lots of feelings about national communication. But I think as a public health infrastructure nationally, we didn't communicate in a way that a lot of people could understand. And we also had to climb over the wall of the belief that individual liberty is paramount.
Yeah, Bernie, you hit on something that's just so important. It's really a system, and it's a public health system. It's how it's built in the USA, federal, state, down to locals, and then our tribal or on our territories. And if any part of that system is not functioning or not communicating well or doesn't have the resources, suffers. You can't meet people and start the communication relationship building right in the event. We need to be doing it now. Make sure we all know who each other is, what's our role, how do we work together, what's our interest. Colorado, we are a local control state. We like that. But that doesn't mean we throw out the system. It's a system that works based upon cultural values and local values. So, but it really shown during the pandemic at times where it's not a cohesive system.
Right. And I'll comment on that. We were actually incredibly lucky to be here in Fort Collins or to be in Larimer County, where we had a large major university that had laboratory capacity. And we were able to, while the state wasn't able to keep up with testing capacity, we were able to develop that capacity locally, which other people in other areas couldn't do. We had a great partnership. And that was a little bit of a circumstance of luck. I mean, I also said hey, we're really lucky here in Larimer County. We are really lucky here in Larimer County. And that's one of the reasons that we're lucky is that we were able to do that.
Yeah, I agree.
The other comment I want to make on the system side, I think the public believes that public health has a lot of power. And I think the reality of it is that that's just not true. And it's not true in two ways. Number one is that our decisions can be subverted politically. And they clearly were during the pandemic. And they clearly are being subverted politically right now. I mean, let's just talk about clean air, right? Let's talk about the environment, environmental health. But the other way that they're subverted is that our budget is minuscule, right? The budget of health care, which is individual and technologically based, right, is very, very large. The budget of our healthcare providers, and I am one, is very large. So our county-wide public health budget is a drop in the bucket of the healthcare expenditures. Yet what keeps us alive is clean water, right? Availability of basic services, clean food, knowing that if I go to a restaurant that I'm not going to get sick. Like that's what actually helps us live a long time. I really began to see, and I wouldn't say that I didn't know this before, but I think I drew a much deeper understanding of this, that the maldistribution of resources into just medical services rather than into communal public health services makes us less well. And to me, that's really important. And it comes up at every board meeting because we look at the budget and we're like, oh, we got X amount of money. We in the healthcare system can spend that in a day in the hospital we get. Like that much money. Takes care of this whole county for a year. So I just think that was impressive. And that was very evident during COVID when we were trying to up ramp our services and hire people to do contact tracing or hire people to do investigations. And we had tiny little pots of money. I just think that that's an interesting dichotomy that the public needs to understand, is that they have this sense that we have this power to do things, but in reality, our budget is exceptionally small and our ability to affect change may lie in the policy realm, but that can be subverted by politics. And that's interesting to me.
You both sort of touched on how partnerships show up in public health, how the health department works with healthcare providers and education, the universities in town. I wonder if you could just comment on the importance of those relationships from the Board of Health's perspective and then day-to-day health department operations.
One of my interests when I came on the Board of Health was in the concept of the health strategist. I think where public health is often incredibly effective is in the development of strategic partnerships based around health data. And if you look at how people trained in public health, is people trained in public health are trained in epidemiology and the understanding of disease or the understanding of health risk factors over time and in populations. And so it was really important to me in our first strategic planning initiative was to really highlight the idea of developing the health department as a strategic partner to other organizations in the community. Again, if we have a really small budget, how do we extend that reach? And the way that we extend that reach is by being the bearer/understander of good data, informing the county commissioners, informing CSU, informing the health systems, and bringing those people together. And I think we did that actually remarkably well. That was like one of the real successes of the COVID pandemic was in bringing, for example, our health systems together and doing that very successfully. And I think Tom put a tremendous amount of work into making the right people be in the same room and actually talking to each other. And those people, they rose to the occasion. And that, again, made the health of our community drastically better. But what we did is we convened and gave data, which to me seems like that was a big part of my interest in our initial
county for various reasons. A great place to raise your family is the board wanted to go in the direction of Public Health 3.0 and becoming the health strategist, being the convener, bringing partners together to solve problems. It was kind of a national movement, and I definitely want to come and let's do this. And I'll give you two examples where it just brilliantly works. First is during COVID, relationships with UC Health, Banner Health, and Public Health. I was meeting with the CEO of Banner and UC Health weekly, and we were getting data from our team. We were transforming more into this health strategist, getting more population epidemiologists, those that have the data. We were getting data from the hospitals. Then that would get data that I could get to the team and ultimately the Board of Health. But I knew daily what was going on in the hospitals. That relationship and partnership, and then having two competing health systems together, working together, saying, well, I can take some space if you need help. We worked as a team in Northern Colorado. Matter of fact, around the state, folks were like, how are you doing that? You guys are setting all of your ego aside and working for the community. And that's those relationships. Another one was right in 2021, data was coming from the hospitals, and we were seeing a large amount of youth, specifically girls, ages 13 to 17, visiting the hospital for anxiety, suicide thoughts, just emotionally stressed. And it was significant that we've got our 3 superintendents or school districts here in Larimer County. We got the community, we got nonprofits, and we sat down and we put together a plan. And what came out of that was the Youth Mental Health Task Force. And I'm proud to say our most recent Healthy Kids Colorado survey is showing that has dropped by 50%.
Wow.
It takes a community to do that. It can't be just one health department, can't just be one organization. But that's where we took data, we brought in the partners. Bernie was at some of these meetings at night at Thompson School District, and we all strategized, broke up in groups, and had action items to go and work on. And that continues because we want to see that number even smaller. But that's an example of where those partnerships and being health strategists actually play out.
Dr. Birnbaum, what would you say you're most proud of from your time on the Board of Health?
I made it. I think I'm really proud of the work that we did during COVID. What I would say of this community, Larimer County, is that we were able to come together. We were able to socially distance. We were able to mask, and we had lower fatality rates than the surrounding communities. The fact that we still have the inequities that we have, that we still had plenty of disease, we were successful. And despite the fact that there were protesters and people, even in political power, that opposed us locally, actually, as a whole, the community really came together and was exceptionally effective. I'm proud of our board's behavior during that time. We didn't all agree, but we really listened to each other. I am proud of the staff. I'm proud of Tom, who got really attacked during that time in ways that as a board, we had to figure out both how to listen to those attacks and also support Tom. So that's probably what I'm most proud of. I will say that this kind of public service is inherently selfish. And anybody who tells you otherwise isn't really understanding. The Board of Health commitment is not the most huge commitment. It's not paid, but it's not massive. And I learned more than I gave. And I really do feel that way. I feel like I learned a tremendous amount. I feel very thankful for the experience that I got during both of my different board services. I feel like I was able to get a real understanding as a physician of what is communal health rather than what is individual health. And the reality of it is it's brought me in my medical practice to a place where I can really understand that the factors and choices that people made are not just about their own decisions and behavior, but about the community they live. And if we can understand that and then connect them back into the community, they'll often do much better. So I think that connected it up for me there, and hopefully helps me be a better medical educator and a better doctor.
So those are some of the examples of the things that you're proud that you did. What is something that you enjoyed doing on the board that you're going to miss?
I think that we're all too serious most of the time and that we need to have a good time. So I think I will miss that having a little bit of fun at the board meetings, because the reality of it is in public health is we're dealing with usually fairly important issues. And they're issues that don't have simple solutions. Like when you're talking about equity, for example, or you're talking about populations that struggle with different things. And I think that I'll miss that. I think I'll miss the knowledge dump. I don't read public health journals, for example, and I don't have a great way to keep up with the world of public health. And I felt like being on the board and being on the health district before that gave me the opportunity to have some window into public health. And that's how I learned about Public Health 3.0. That's how I learned about a lot about the epidemiology that I understand.
And Tom, what are you going to miss about working with Dr. Birnbaum?
Well, right there, the humor. Yeah, he was. Gosh, he could put a smile on you in the most trickiest times. I'm going to miss just his knowledge. You just listening to him. He comes with a wealth of knowledge. I can give you tons of stories. One I'll give. Just last year, we were doing Radon Action Month and talking about our plans to get the free test kits out and educate homeowners and renters regarding indoor radon. And Bernie's right there said, "Hey, have we thought about educating healthcare providers, doctors?" And we hadn't. And we put together a whole program. It was so successful this year because now they're aware and they can now educate to their communities and to their clients. And so that's what we're going to miss, because he's very good at connecting dots. Bernie's well involved in the community. I've always looked to him. I'm going to miss him. He challenged me, and that's important. I can get complacent too. You need a board that's going to ask questions. They're going to challenge you. They're going to say, we thought about this, going to get us out of our comfort zone, because that only makes us better. And our outcomes ultimately for the community are 377,000 people. That's the goal. We got a great board of health. They work very well. They disagree at times, but they do it in a manner that it produces a good outcome for staff.
So, Dr. Birnbaum, as you reflect on your time with the board, do you think you had the impact that you were hoping for when you first joined?
I mean it when I see public service. I believe that public service is at least somewhat selfish, right? People like to say a great public servant is someone who is selfless. And that is somewhat true in the political realm. Like a great politician reads all the stuff they're given and knows the details, right? I feel like I learned an unbelievable amount, and so I'm incredibly thankful for that. I hope that I did a couple of things. One, I hope that I challenged Tom in the way that you're talking about, but also made you feel supported. I hope that the staff felt like we as the board had their back, right? I hope that the staff understood that they are the experts in public health and that the board is filtering that expertise to understand how that works in our community, right? Which is fundamentally that's what the role is. And so I hope that was successful. I'm very proud of how we dealt with the pandemic.
I'm wondering, for the person who fills your shoes, what kind of advice would you give them?
You got to come prepared to meetings, meaning that, they send out the information that we're going to talk about. And I think it's actually pretty important to read that. And I think it's pretty important to think about what are the implications of the things that we're going to talk about for this community. I think particularly for a physician coming into that role, I think understanding the difference between individual and public health is really important, and it's really hard. And I found myself struggling with that sometimes during COVID, because I would, as a doctor, go down that path of what's best for an individual, right? When in reality, you have to be able to pull back from that and say, how do I think about community-wide solutions? And then I think the final thing is really listen to the staff, listen to the presentations, because there are little nuggets in there that are really important. And then the final thing that I would say is our job is not to micromanage stuff. We are, like I said, we're not the experts in public health, but we're also not the people doing the work. So I think sometimes as a board member, we want to ask really nitty-gritty questions that parse out things, as that's really not our job. What we're looking for is big picture things that we need to push in a different way, and then trust the staff and the director to be able to manage that appropriately, unless we have data that shows otherwise.
What is the secret to a good board? How do you guys, when you disagree, actually come to a consensus?
I mean, you have to start from a place of mutual respect. I think the reality of it is that anybody that's choosing to serve in this capacity is trying to do so for good reason. Anybody coming onto the board is looking to serve in some way. And that doesn't mean that they all do it perfectly. But I think if you start from that understanding of respect and treat each other that way, you can have pretty big differences in opinion or in approach, yet come to consensus. The other thing that has been really fun on this board for the full 10 years that I've been on it is that there really has been an attempt to find consensus. That doesn't mean that we always have to be right in step. But early in the board, I remember doing a retreat. It was before Tom was here, and talking to one of the board members and realizing that we really had some fundamental disagreements around how we would approach something politically, but that the underpinning values were the same. And we were able to take a step back and say, well, we really respect each other's values. So how do we find a place where we can have a conversation about this topic? And that was really cool. I mean, I learned a tremendous amount from that, because I tend to be very strong political left, but I was really able to, in that context, both with the county commissioners at the time, who I did not agree with, and with this board member, actually find a tremendous overlap of core values that allowed us then to work together very amicably. That's where a board needs to start, is with that place of mutual respect. I do wish that there was more time to get to know each other. And I think it's always hard. You come here after work at 5:30, you shove some food in your face, by about 8:30, you're like, blah, blah, blah. And so there's not a lot of time for that bonding, but I do think that some of that's really important. Hence why I think retreats are so important.
I would also add too, and this was when Bernie was president, While we were working on a new tool to evaluate the public health director, it was also, well, let's do a self-evaluation for the Board of Health. The Board of Health every year now does, and it's the third time, done a self-evaluation. And there, during a retreat, a work session, the board has those kind of conversations about where are we not aligning? What are we doing that maybe isn't working? And those are very healthy conversations. And I think that just fosters this board to work even stronger together and get to know each other a little better. So that's something that under Bernie's leadership implemented about 3 years ago, wasn't it?
More as it was 2021 or
Yeah.
2022. We worked with a consulting group to help come up with an evaluation for Tom that helped Tom grow, as opposed to just, I don't know, just give feedback that maybe is hard to act upon, and then help the board to ask the questions of how do we work together better. But I think it's been helpful. I think it allows us to see each other for who we are and where we come from. And I do think it's interesting, we each represent different constituencies. And I think it's important to remember that, and to remember that each of those constituencies is very valid, and part of the community. So I think that's also an important piece of that.
Is there anything on the horizon that you're excited or interested to see the health department tackle now as a Larimer County resident?
Yeah, I would love to see us continue to delve into policy, because ultimately policy that happens around health is what leads to change. Things that I think are important are regulation of tobacco products, but particularly vapes, I think is an important one. I think looking at our food security system is really important. I think we have to maintain the fiduciary responsibilities. Like, we have to be really good at restaurant inspections. We have to be really good at septic system things. I those are elements that we need to maintain. But I think as we get really good at doing that and keep that tight, let's also make sure that we're looking at policy both on the regional and state level. I love that Tom's involved in regional and national public health leadership. I would love to see other staff engaged in that. We had a presentation at one of the last board meetings from one of the environmental health people who had gone and done work in Puerto Rico. And I think those sort of involvements beyond the county, while you could argue that they detract from the work that they're doing here, actually make us much stronger and lead to partnerships that make the department stronger, and hence the health of the community stronger.
Do you have any plans for what comes next, either in terms of public service or just with your free Thursday evenings?
Not yet. I like to joke I have a 1.2 FTE job. So I got plenty of work to do. I still actively have a patient panel that I manage. I teach medical students and residents. I help administrate our residency program. I think in the short term, I'm going to do that. I'd like to look at ways that I could get involved either locally or regionally to stay involved in public health issues, but they don't have to be named public health, right? So, one of the biggest public health features of any community is its transportation system, right? Another example of that is environmental health. Like, how do we think about our healthy environment and the structures that we put into that community to keep us healthy, keep us moving? I think about housing. I think housing is just an absolutely huge issue in Fort Collins specifically, but in Larimer County as a whole. And how do we think about good, stable housing that people can afford to have a reasonable job and live in? And, I, as a physician who makes good money, could not move here and live where I live now. Like, there's no way. I live right in the center of town, and my house would be way overpriced for what I make. So I think thinking about how do we think about that stuff all feels like public health to me, because ultimately, if you don't have stable housing or stable food or stable transportation, you cannot make healthy decisions. And we put all of our money into the healthy decision side and not into those structural things that make us healthier. So I'm interested in that.
Another thing that Bernie brought was with his residents. They spend a week or two with us and learn what we do in public health. I think that has been a wonderful synergy right there with that.
Yeah, I want to maintain that. I started a rotation for medical students at the CU at CSU branch campus looking at community perinatal health. So for moms and babes. And that's been really cool. And it's been a great partnership. I'm doing something similar with the residency. I want to make sure that future healthcare providers that provide individual health really fully understand that health is about the community, not about individual decisions. And I think that's important. I call it polluting young minds, but
And at the time, we can give them a radon test kit too.
right.
Look at
I actually got a radon dex kit and radon mitigated my house, and I'm incredibly healthy now.
You just mentioned, there's these staff development opportunities that can really change somebody's life. Was there anything similar to that happened to you that had, that lightning strike moment where you're like, hey, I want to get into healthcare in some fashion? It sounds like you were passionate about serving underserved communities, and just also kind of curious how that came.
There's a couple of ones that I'll throw out there. I mean, the first one, I knew I wanted to be a doctor when I was like 8. So this was a long career path for me. But I think part of what pushed me towards education was a group called Generalist Physicians in Training that was run by the American Medical Student Association. And I was in medical school and seeing the reality that what our country needs is good primary care doctors, and having great mentorship in that process pushed me towards wanting to be a primary care doctor that mentors learners. So that's one thing. And then mentorship during medical school from great people who were like, you can do this. In the more recent past, probably serving on the health district board, which the way that I actually got there was Avi Strand, who was the nursing director here for
51 years.
Who had also been on the health district board. I met her early in my time here on Fort Collins, and she said, you'd be really good at this. You should do this. You have something to offer, and you'll learn a lot, which was the thing that came for me. And you can run for this, and we can see if we can make it happen. And so I ran for that position, and that was I'm an energetic guy. I need a lot of input. It helps me to have things that I'm working on, and it gave me that thing that it gave me something to learn about.
Awesome. Well, Tom and Dr. Birnbaum, thank you both so much for joining us.
My pleasure. Thanks, Bernie, for 10 years on the Larimer County Board of Health. Appreciate you.
Thank you. I'm going to miss it a lot. Like I said, it was an incredible learning experience. So maybe I'll have to read a book now.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.